All right, so I'm going to be administering an intramuscular medication. So I have my medication right here, and I'm walking into the patient's room. So when I enter the room, I wash my hands, I provide privacy for the patient, and I ask the patient for their name and date of birth, and also compare that to their wristband. And again, I'm also comparing it to my MAR sheet to make sure I have the right person, and again, the right medication and the right dose and the right route and the right time, just making sure everything is correct. And then I'm going to explain to the patient the medication that they are getting, why they are getting it, where they are getting it. I'm also verifying if they have any allergies or anything like that. And then I tell them where I'm going to be administering to them on them. So after that, then I'm going to be putting on my gloves. All right, and then I'm going to clean the area of the skin that we're doing the injection. So I'm going to clean for 30 seconds. So I'm just going to go like this. So we'll do that for 30 seconds, and then I can go in the trash. And also we'll let it dry for 30 seconds. And again, while that's happening, I can answer any questions that the patient has, or again, just be double checking my MAR and my medications, just making sure everything is good. So after 30 seconds, once that has been dry, since this is an intramuscular, I have the option to do a Z-Trek depending on the medication. So if we're doing that, then I'm going to be going like this to the skin. And because it is intramuscular, I'm going to be going at a 90-degree angle. So when we're ready, I'm going to uncap the needle. I'm going to put that off to the side. I'm going to hold it like a pencil. And for Z-Trek, I'm going to be moving the skin over just like that. We're going to position here. We're going to go in first. I'm going to make sure I'm stabilized with my needle, and then inject it. And then hold back again. Pull straight out. And I would immediately put the safety feature on and put it in the trash. All right, for the purpose of this, since I'm going to be using this again for testing, I'm going to do the one-handed recap and setting that aside. And so now I'm making sure that I'm putting gauze over this. If there's any bleeding, I'm getting my patient a Band-Aid. And then I'm going to be removing my gloves, throwing those away. I'm going to wash my hands, and then I'm also going to document the medications from the MAR that I gave the patient. And that's it.